Our Benefits and Insurance Committee meeting. This is July the 23rd, 2020. At this point in time, looks like we've got a lot of people that are Zooming with us today because the courtroom's a little shy. But at least hopefully we'll have enough for a quorum when we call the roll. So, Ms. Corbin, if you would please call the roll, please, ma'am.
Thank you, sir. Preble, Acton. Preble, Acton. Rhonda Allen.
Here.
Thank you. Dr. Andrea Anthony.
Here.
Doug Bodery.
Here.
Amber Brown. Amber Brown. Shay Crowell.
Happy to be here today.
And we're happy to have you.
Oh, I see you, Amber.
There's Amber.
Holly Deering.
Here.
Alan Farley. Alan Farley. Mary Hickerson. Lois Miller.
Here.
Alan McAdoo. Jeff Phillips. Jeff Phillips. Shantae Sherrill. Eric Tutobeni.
I am present via cell phone today.
Thank you very much. With you, Mayor, it's a quorum.
We have a quorum. Thank you, Ms. Corbin. Now, since we are zooming in on this, I must read this statement. This meeting of the Benefits and Insurance Committee is being conducted electronically pursuant to Governor Lee's Executive Order 16. I would ask for a motion that conducting the meeting electronically is necessary to protect the public health, safety, and welfare in light of the coronavirus. Is there a motion?
Jay Crowell, I make that motion.
I have a motion. Is there a second?
Andrea Anthony, I make a second.
I have a second. Thank you so much. Ms. Corbin, if you would please call the roll.
Yes, sir. Preble Acton. Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber Brown.
Yes.
Shay Crowell.
Yes.
Holly Deering.
Yes.
Alan Farley. Lois Miller.
Yes.
Jeff Phillips. Eric Tutobeni.
Yes. Yes.
All in favor?
Motion passes. Next, members, item number 4 on our calendar today is approval of the minutes from the May meeting. If you would, whoever makes a motion, just say your name and then I move, and then whoever does a second, so we can keep up with whoever is making those motions in second. Do I have a motion to approve the minutes from the May meeting?
This is Lois Miller. I move.
Lois Miller made the motion. Is there a second?
Jay Crowell will second.
Jay made the second. All right, Ms. Corbin, call the roll, please.
Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber Brown.
Yes.
Shay Crowell.
Yes.
Holly Deering.
Yes.
Mary Hickerson. Lois Miller.
Yes.
Jeff Phillips. Shantae Sherrill. Eric Tutabeni.
Yes.
Yes, sir. All pass. I'll say yes.
Thank you, Ms. Corbin. Approval of the minutes passes. Next, members, item number 5, financials. Mr. Elam, Director of Insurance and Risk Management.
Yes, sir. Looking at your first set of graphs, you will see that our revenue exceeded our expenditures. If you flip over to the tracker on the second page, you'll see for the month of May, there was $8,585,286 in revenue, and expenditures was $4,610,269. In revenue less expenditures, there was $3,975,017. For the calendar year, you'll see that the total is $41,062,223 in revenue. Expenditures, you will see $29,773,028. With the revenue less expenditures, $11,289,194. If you flip down to where you see the total enrollments, we have 6,246. And then to get down to the 2019-2020 fiscal year, you'll see for the totals for it is $72,934,201 in revenue compared to $69,056,629 in expenditures, for a revenue less expenditures, $3,877,572. On the 266 fund for the month of May, you will see that there was a decrease compared to this time last year. If you flip over to the tracker on the second page, and under our claims, you will see $59,970.34 compared to last year. There was $76,967.05. And in that month of May, of that $59,970, $6,428.35 was workers' comp. $53,541.99 was OJI. Year to date, if you look at the box to the far right, you will see year to date we are at $611,834.98. And year to date last year, we were at $734,204.91. And we're running about 87% of what we were last year. And that concludes my report, Mr. Chairman.
Thank you, Mr. Elam. You've heard the report by the director. Are there any questions? Hearing none, is there a motion to approve the financial report? Is there a motion?
This is Lois Miller. I so move.
This is Rhonda Allen. I second.
Motion and a second. Any further discussion? Hearing none, Ms. Corbin, call the roll, please.
Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber Brown.
Yes.
Shay Crowell.
Yes.
Holly Deering.
Yes.
Lois Miller.
Yes.
Jeff Phillips. Eric Tutobeni.
Yes.
All in favor, it passes.
Motion passes. Next, that brings us to item number 6, the workers' comp and OJI statistics. Safety Director, Mr. Good, if you would please come forward, and you'll be recognized at the well.
Good afternoon, sir.
Yeah, good afternoon, Mr. Good. You're recognized.
Thank you. I'd like to report in the month of ending in May that we had a total of 8 injuries requiring medical attention. That brings the total for the year to date to 60. Of that 60, 44 are OSHA recordable, 31 were restricted days, 6 lost time days, and 7 all others. Just want to pick up on the note again. County schools were closed because of the virus effective March 15, and were closed through the end of the school year, which was the end of May, which this report takes you through. Also, county offices were closed for the entire month of April. Looking at the next page of the report, you'll see that the 60 injuries that we have year to date for this year compared to the 2 previous years of last year of 118 and 2 years ago at 110. The incurred dollars for the year-to-date total for this year, 2020, is $200,000 compared to last year, which was $220,000, and the previous year of $277,000. Looking at the last page of your report, I want to make note here that the Board of Education had 7 injuries. County General had 1. Because of the schools being closed for the month of May, normally they're open because of classes, they don't start their cleanups until the month of June. This time, because school's being closed, they were actually able to start earlier. And so that's where those injuries came from in the Board of Education, working, again, the moving furniture, stripping floors, things like that. The 1 injury for the County General was actually in the Sheriff's Department. That's all I have at this time, sir.
Thank you, Mr. Good. Are there any questions before he leaves? Hearing none. Is there a motion to accept the report?
This is Amber. I'll motion to approve.
Thank you.
Shay Crowell, I will second.
And a second. Thank you, ma'am. Ms. Corbin, if you would please call the roll.
Yes, sir. Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber Brown.
Yes.
Shay Crowell.
Yes.
Holly Deering.
Yes.
Lois Miller.
Yes.
Jeff Phillips. Eric Tutobeni.
Yes.
Mayor? Yes? Yes. All right. Yes, it passes.
Motion passes. Thank you,
Very
Mr.
much, sir.
Good. Thank you. Next, members, we have 2 positions, members at large, who have their term is expiring. As county mayor, I have the ability for appointment to fill these 2 member at large positions, and I have asked each one of those. They're currently in those positions, but this will be a renewal, so I'm reappointing Lois Miller and Amber Brown, and both have accepted those 2 positions. So based on my appointment, is there a motion for these 2 members to be reappointed?
Andrea Anthony motions for reappointment of both members.
This is Rhonda Allen. I'll second.
We have a motion and a second. Any further discussion? Any other nominations? No, because I don't know when to appoint. Sorry, that came out wrong. All right, Ms. Corbin, if you would please appoint.
Yes, sir.
Please call the roll.
Lois and Amber won't vote.
Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber, can Amber vote on herself?
Somebody knock on the door.
Amber Brown.
Can't vote for herself.
You can't, okay.
I can't
Yeah,
vote.
Okay,
Yeah.
I didn't think so. Shay Crowell.
Yes.
Holly Deering.
Yes.
No. Jeff Phillips.
Yes.
Eric Tutobeni.
Well, I don't have a dog to bark in the background, but I will say yes.
That gives us 7, because 2 cannot vote.
I'll vote. I vote yes.
Okay. Yeah.
All right. Congratulations, ladies. Thank you for reaccepting the position. Your input and your expertise is welcomed again. We look forward to working with you over the coming year. Members, next we have item number 8. We have our midpoint report from Shannon McNair. Ms. McNair, are you on with us?
I am. Thank you, Mayor. Is Stacy going to share my report, or did you want me to share it? Mr. Elam or Stacy? Oh, it's up there. Okay. Good afternoon, everyone. If you'll turn to the next slide, please. So if you're looking at this month at MedPoint for June 2020, we saw a total of 861 total clinic visits. That includes 729 provider visits. And I'd like to include, just as a reminder, that includes both telephonic and video virtual appointments. And they're reported there in those provider visits, since they are provider visit types. We had 83 medical assistant visits, which includes labs and injections. We had 9 visits that members came in just for their biometric only. We had 8 occupational health visits in June. Did want to mention here that we did have, the PAWS department asked us if we could administer some more rabies vaccinations to some of their members. So we did have a couple of those members come in and receive rabies vaccinations. So that's why we have 8 occupational health visits. And we have 32 wellness visits, and those include those visits where members are seeing our registered dietitian. If you look down at the non-face-to-face encounters for the month of June, we had 930. That includes 275 orders only, 577 communication encounters, whether that be through a telephone conversation with direct member outreach or portal communications. And then if we reviewed results and sent out a letter, we had 78 of those in. Next slide, please. This slide just goes over our provider visit breakdown. So out of those those 729 provider visits, 281 of those were virtual visits. 254 were just standard office visits. We had 100 annual physical exams completed in the month of June, 43 sports physicals, and 12 well-woman physical exams. On this next slide, you see our clinical quality metrics for the MedPoint Wellness Centers. If you look down at the bottom at our 2020 year-to-date, that gives us January through June. At the top of each section in the bold, you will see that the goal for each section. So under diabetes testing, our goal is to hit greater than 93.67% of all diabetics getting their testing for their A1C within 6 months. You will see for year-to-date, we were at 93.40. I will mention here that with the coronavirus, if members were compliant with their medication refills, if they were their A1C was within normal limits on their last test due to the coronavirus and the exposure risk to diabetic patients, we may have pushed out their A1C testing by a month or 2 just to decrease their exposure risk by bringing them into the center to get that blood drawn. The next column is that control of that A1C. So the goal is to be greater than 64.96% of all diabetics have an A1C of less than 8. And you'll see that year-to-date we're at 65.09%. And then for hypertension control, that's a goal of less than 140 over 90, and we want greater than 69.83% of our hypertension patients to have that blood pressure control of less than 140 over 90, and we were at 72.95% year to date. Next slide, please. This is just going over our month-to-month trends, so you can see where we are year over year and month to month. So obviously 2020 being in the purple, you see that decrease in April, and then we're starting to climb back up as we're doing more outreach to members, and more members are more comfortable with the virtual and coming on site for things that are essential visits. So in June, you'll see we had 861 compared to June last year. We had 866 total visits. This slide is just trending our non-face-to-face encounters, and as mentioned previously, we're doing a lot more direct member outreach. We're really doing a lot of communication with our diabetic and high-risk population, just knowing that they're at a greater risk with coronavirus. We want to make sure that they're good with all their medications, that they're taking care of themselves. So all of those high-risk patients we're doing more direct member outreach with. So you'll see in June we did 930 total non-face-to-face encounters, and that's an increase from 577 of June last year. And then lastly on this slide is just our summary. So if you look down to June 2020, we had total unique members at 559 total unique members. Total operating costs was at $278,510. I do have a notation there if you look at the bottom. So for the month of June, there was 3 pay periods in that billing compared to 10 of the months out of the year only have 4 pay weeks in them. So this one included 3 different pay periods in it. I'm sorry, so just to clarify, 4 weeks versus 6 weeks, 2 pay periods versus 3 pay periods. Just wanted to clarify that. So we had 3 pay periods in June. Employee count was 6,242 for a per employee per month of $45. That concludes my report, Mayor. If there's any answers.
Thank you, Ms. McNair. Are there any questions? Okay. Thank you so much for your report. Next, we have item number 9, clinical transition update. Ms. Martin, Ms. Christy Martin, you with us? Ms. Christy Martin.
Good afternoon, Mayor. Sorry. Can you hear me now?
We can. We got you. Go ahead.
All right. Yeah, the clinic transition is going well. We've been meeting with the Rutherford team weekly and made great strides. The flyer that is pulled up here outlines what the transition will look like. September 1st, we do plan to open the New Salem Care Center that afternoon, and then Stewart's Creek and Walter Hill to follow the following day. So we're really excited. As I mentioned, things are falling into place. We are, as we simultaneously plan to open under normal circumstances, we are considering COVID and plan to make any adjustments needed over the next few weeks as we see how things will progress, hoping for improvement. We do plan to offer virtual visits as well as in-person visits, so we have no concern about your members getting the service they need, but we'll be keeping that in mind. Also planning for ribbon cutting activities. Some virtual ribbon cuttings are being considered as well, but really looking forward to it, moving this forward. Any questions from the group?
I've got one question for you, Christy, or for Mr. Elam. When will this notice that we have here before the members, will this be sent out to all those concerned?
Mayor Ketron, what we're going to do is we're going to send this out to all employees and all those that are on the plan themselves. One of the things is with open enrollment coming up, somebody that's not on our plan might want to get on our plan and see this. Mm-hmm. So it should go out afternoon, and they should receive it sometime, and it'll, of course, it'll go to the Board of Education, and then they will forward it to their employees. Please.
Okay. Are there any questions? Well, the main thing is just through education and keeping all of our employees informed of dates and times. So this is a very important sheet. That'll go out today, you say?
Yes.
Okay.
Yes.
All right.
I have it sitting on my computer, ready to go.
Okay, awesome. Any other questions for Ms. Martin or Director Elam? Okay, thank you for that update. We're looking forward to months to come.
Thank you.
That brings us to item number 12, our wellness update with Mr. Chapa. Mr.
Thank you,
Chapa.
Mayor. Can everyone hear me okay?
Yes.
Yeah, we got it.
Okay, perfect. Just to review this month's numbers, and again, a reminder, Director Elam had asked me to kind of show the compare contrast between where we're sitting right now versus where we are last year, especially with the COVID outbreak going on. So as per July, we are sitting at 1,249 annual physicals, which is actually a little bit higher than last year at this time. Biometric screenings are sitting at 1,726 versus 1,919. Health assessments are sitting at 416 versus 783. Mammograms are at 710 versus 744. OBGYN screenings, 1,176 versus 1,214. Colon cancer screens, 290 versus 282. Cervical cancer screens, 1,008 versus 1,102. Prostate exam screenings, 305 versus 311. And flu shots are currently sitting at 1,876 versus 1,700. And to date, if our goals were active, we'd have 2,036 individuals that had met their completed requirements versus 2,094 at this time last year. Some current and upcoming events and some that I've been able to pull in combination and collaboration with St. Thomas. So we've been able to get the St. Thomas mobile mammography bus up and going. We actually have a mobile mammography set up for tomorrow at the Smyrna County Clerk office. I'm happy to report that we were able to fill up every single one of those appointments in about 3 days. So definitely need and demand for that. We've also got several scheduled with the Board of Education at their office. So Dr. Anthony, I'll be working with you to kind of work through logistics on those. But just to let everyone know, we do have those scheduled, and I'll be sending out the online scheduling through our channels. So I appreciate the help with getting that out to everyone and making that such a success so far. And that will conclude what I have for my report.
That sounds great. Thank you so much for that update. Next, Mr. Chapa, is MotivateMe points.
Mm-hmm. All right. And let's see. Let me go ahead and pull up my presentation here. All right. Can everyone see my page there?
Yes.
Okay, thank you. So at the last May meeting, we've been asked to really take a step back, take a look at the current incentive program and some of the enhancements that might be possible and some of the recommendations that we can make around some of the new programs that we've added and how to kind of keep that momentum going with the success that we've had. Working with this program now for 3 years, we've really established a great level of engagement. We hover between 88 and 90% right now. And so to continue that level of engagement, we basically have, and I'll get into it here in a little bit, but to preface everything, we've focused, traditionally, we started with a biometric screening and a health assessment. We enhanced these programs and we added a lot of preventative screenings, which we'll go to in a second. Basically, we have gone to a level of 88 to 90%, showing that people are going out and they're getting this information and they have the information at their hands. Now we need to kind of look, what do we do with it and how can we take this to the next step? So that being said, this is what we currently have in place for our MotivateMe program. So like I said, we added the preventative screenings. There's 7 of them. So everything from an annual physical, mammograms, OBGYN exams. We've seen a lot of feedback, a lot of really positive feedback from this because it gave a lot more opportunities to be able to get that incentive, but also actionable things that are really helpful in helping to change health disparities and improve upon health outcomes. So with that being said, some of the enhancements that we're looking at and what we're trying to do is we're trying to take existing programs that you have. And so to be clear, all of these programs and all of these recommendations that I have are things that you currently have. There's no addition, there's no installation. These are literally existing programs that you have. We're going to tie that to engagement and to your incentive program and try to boost that. So that being said, one of the first things and what we had talked about at the last meeting that kind of spawned this was adding the OMADA program to the incentive goal structure. Another one is going to be adding lifestyle management health coaching to your incentive goal structure, and also adding chronic disease management coaching to the incentive goal structure. And one of the reasonings behind this is making sure that everyone, no matter health status and where they're at, they have an opportunity and a program that they're able to engage in. So with the OMADA program, that's targeting your pre-diabetes population, that's trying to really impact those individuals that may be at risk of developing into diabetes. So it's capturing them and it's giving them an opportunity and a program to use. So obviously tying that to your incentive program structure to boost both motivation and engagement would be a really good move. With that, lifestyle management coaching. So there will be individuals who do not qualify for the OMADA program just simply because they're not at a health status that would warrant that level of engagement. So with that, the lifestyle management coaching would give an opportunity for those that are in the healthier attributes or the younger population, those that are really active and looking for more of a lifestyle goal, focus, other things like that. And I'll deep dive a little bit into some of the programs and what some of the focus areas are. But that would encompass your individuals in that mode. Then you'd capture the OMADA group that's in that middle bracket. And then for those that don't qualify for OMADA or have a greater need for a clinical focus, you would add the chronic disease management coaching. So that would capture those individuals that have at least one diagnosed condition and would help them with medical care management, managing that condition, things like that. And we'll go into a focus here in a minute on what that can go into. But in a nutshell, these are the basic recommendations. So that said, for the OMADA goal, the goal that's in your MotivateMe system currently, and that would be the most appropriate, would be to add the goal of completing 16 weeks of the OMADA programs. That's what you would do to earn that incentive point. The reasoning behind the 16 weeks program with the OMADA is that the first 8 weeks of that program is really a deep dive with that coach. They're building rapport, they're working with that individual to identify the best path forward. Once they get past that 8 weeks and they get into that next half of the 8 weeks, it's really kind of boosting that self-efficacy, getting that individual to start doing it on their own. So the coach gives them the tools, they gives them the education, and then they kind of set them on a path. They're still being supported, and they still have access to everything, but it's a lot more user engagement than it is the coach guiding that engagement, if that makes sense. So again, we've launched the OMADA program. We've seen some engagement with that, but again, tying that to this incentive program would be that next level to push it. And it would be a great opportunity for that pre-diabetic population that you have. So the next one that I have is the lifestyle management health coaching goal. So that goal would be to set and achieve a personal health goal with a coach. So that individual would join the program that's qualified. So reminder, these are the individuals that tend to be of the healthier population that don't have a chronic disease or other things like that and don't necessarily want to engage in a program like OMADA. This would provide them with an opportunity to be able to take part in this. And so really they would work with that coach, identify a focus area, and then they would set that goal. And that's what would trigger, once that coach identifies that they've met that goal, that would be the trigger for the incentive program. And so, like I said, this is really an alternative for individuals who either don't qualify for OMADA or the chronic disease programs. It gives that population an opportunity to have a similar program and earn that incentive. And also, you'll note down there as well, all of these programs, be it if for some reason that an individual did not fit into any of these three categories, for whatever reason, there is an activity-based physician alternative waiver, so that individual will just talk to their physician, have them fill out this form. I have copies of it. I've helped individuals in the past with this. And basically that physician would identify a reasonable alternative, and so that keeps you in compliance with all of these programs. Last one, again, is going to be that chronic disease management. This is really focusing in on the chronic disease. How do you take that to the next level? How do you engage with these individuals? How do you help them with this process? And so these coaches are really focused on helping with this aspect of it. And so it provides an alternative, again, if an individual wants to get into a program and have help with things like diabetes management, chronic condition management, they do not qualify for the OMADA program. This is the opportunity for them to take part and be assigned a coach and work with that individual to get to that health outcome. And like I said, all of these are eligible for that physician waiver. Sorry, was there a question?
No, keep going.
Okay. So with the health coaching focus areas, so the Your Health First chronic disease coaching areas, the coaches really work to meet the individual at their level. So wherever they're at, that is what the coach is going to try to focus on and help with that area. That being said, there are 16 main focus areas for the Your Health First chronic disease program. Again, they can customize to the individual, but these are some of the main areas that they're going to look into. So if that individual has a health disparity that fits into these types, they are going to help focus in these areas like this. For the lifestyle management program, again, that's that healthier population or younger population. The main three pillars of their program are going to be focused around stress management, smoking cessation, and weight management. Again, they're going to cater to the individual. They're going to make sure to meet the individual where they're at and help them achieve that health goal or that recommendation from the physician or wherever it's coming from. Other areas that they focus in on too, and a lot of things that we really don't think about, but they focus in on the diet, exercise, nutrition, pre-diabetes, all these things to help, again, meet the individual where they're at. But a lot of these three are tied to the same health disparities, nutrition, exercise, high blood pressure, pre-diabetes, things like that. They can impact all these three areas. So that is really going to be the core focus of what these lifestyle management coaching programs are going to do, and that is how they're going to work about setting those goals. So with that being said, basically our recommendation is going to be continue to keep the program requirement to earn the incentive at 3 points. Continue to keep it exactly the way it is. Continue the incentive, $300 premium. All eligible employees and spouses on the medical plans, dependents are exempt. That being said, continue with the annual physical as a 2-point value goal. And then in addition to your current 7 preventative screening goals, for a 1-point value, add the chronic and lifestyle management coaching for a 1-point value, and then add the complete 16 weeks of the OMADA program for a 1-point value. If we see a real success and uptick in engagement, we can identify at a later time whether we want to reevaluate what that point value should be, if it should be higher, or if we want to modify this. But I think with just the history and the feedback that I've gotten out from the field, members are pretty knowledgeable of how this works now, and this has been pretty effective in the past. So that being said, I know that was a lot, and I went kind of fast, and I apologize for that, but are there any questions?
Are there any questions?
Mr. Chairman, this is Rhonda Allen. I have a question.
Yes, ma'am. Go ahead, Commissioner.
Chuck, you asked, or you mentioned that the program is effective. I guess that was one of the questions I was in my mind the whole time you were presenting, and that is, we're talking about prevention, so how do you prove that this helps not make something happen? How do you measure its success?
So it'll be boosted in. Basically, your annual reports on preventative engagement. You'll start to see a lot of your year-end reports. You'll be able to kind of see an impact with that and drift. And then I've also got Paul that can help answer some of these questions as well, if we need to.
Yeah, prevention's never a bad idea. I was just curious how you measured success.
Hey, Ms. Allen, this is Jay too. What I might add, is Paul may be trying to come on as well, is when we look at the quarterly or annual reports through the Cigna portal, that when we review them with the medical directors, pretty much all measurements, whether it be their claims or their preventive utilization, wellness visits, things like that, are well below Cigna's norms and what we see with some of our other clients in Middle Tennessee. So that's with the current program. So I guess maybe another way to think of that, if we're stepping up the program to a little more results-based, maybe, trying to get them more engaged in other areas, we're hopeful that we'll continue to see those results even get better. So I think what we started off with, and maybe Chuck said that, or even Mr. Elam, the program we have today is exceeded all, I think, expectations from the start. This is kind of just that next level. So we're hopeful that we'll continue to see that even get better.
Excellent. Thank you very much.
Thank you.
And this is Paul Huffman. I'll add just another comment. Right now, you typically see about 40% of your group has a chronic condition, and that group generally drives about 70% of your total claim cost. So anytime you see the adjustment in those numbers, a lower percentage of chronic, a lower percentage of claims driven by that population, you have success. And the only way to really get chronic individuals to have less claim is for them to manage their condition in a better way and to be coached as to evidence-based medicine and how to manage their condition.
Very good. Thank you.
Other comments? Other comments? Mr. Elam.
Mayor Ketron, I asked Chuck and Paul to bring this to the committee. Where we're at is that, and looking for a recommendation from the committee, is that we're getting close to getting all of our stuff together for annual enrollment, making sure that starting October 1, people know what their incentive points are. So we have to kind of have that in place. And we're also looking at, like the OMATA program, it's our participation is not where it needs to be, but the people, once they're in it, you have very, very few people, very, very low percentage of people that get out of the program. So I think it's one of those programs that's successful. It's just, we just haven't got an incentive to get people to participate like I think we should. And it's definitely going to prove that it will lower our cost, I do believe. But the other thing about the coaching is, like, when people go get a biometric screening done and something shows up, what we want to do is take the next step and say, hey, let's help you with something on your biometric screening, maybe through coaching. And so this is, as Chuck said and Paul talked about, this is kind of the next step that we go to, provide a service for the members. And one last thing is, Chuck, this is something that just came up that I really hadn't thought of and we hadn't had any discussion about. But on these, on the coaching points, are we going to limit them to where this coaching's just going to be, they can just have one coaching, or could you actually get all 3 points through coaching? What's your input on that?
So you're saying if they took part in coaching, so the way the recommendation currently sits is that it would count as a 1 point value. So if you looked at the whole year on doing, trying to get your incentive, you could do like whichever version of coaching you did, you'd get 1 point. And then if you did like an annual physical, that would be 2 points, and that would be your 3 total points. So you're saying you change up the point values to where coaching could be all 3 points in one single go?
No, we would set the system so that it would limit the amount of times people could achieve a point for coaching as one time a year.
That's what I was asking, Klaus. If someone wanted to get into stress management and weight management, that's all one point for coaching, correct?
Right, correct.
Okay.
The other item to mention, or just to reiterate, is that these programs, the Your Health First chronic condition coaching and the lifestyle management coaching, are already in place. So these coaching programs have been available for years to these members, and participation in these programs does not increase cost. In fact, it decreases cost. There is no additional cost for people to participate in them. So any of these incentives will not drive increased costs.
Paul, this is Lois Miller. I have a question. Since those programs are already in place, what is the current utilization of those programs?
We have that in our annual report. I don't have that in front of me, Lois, but we have engagement percentages for each program, and it varies across the board on how that's measured. So we don't just have a participation number for someone who calls in. It is measured a lot more complex than that. I can send you some of that information if you need it.
Okay, thank you.
Mm-hmm.
Other questions? Hearing none, thank you, Mr. Chapa. I'm going to require that this go to our steering committee for approval because it is an addition on these MotivateMe points. So I'll entertain a motion, Chairman, entertain a motion at this point to forward this on to our steering committee of the County Commission. Is there a motion?
This is Lois
Chairman?
Miller. I'll move.
Ms. Allen?
Yes, I'll second for the purpose of discussion.
Who was the first?
It was me. It's Lois.
No, Lois, you made the motion?
Lois made the motion?
Yeah.
All right,
Thank you, Lois.
I think Rhonda and I tried at the same time.
Oh, at the same time? All right, bled over.
But, yeah, this is Rhonda Allen. I seconded because I just have a question.
Sure.
I'm not clear on, has that typically been the protocol that these decisions would go back through steering? I don't really remember insurance committee risk management referring things back through steering.
Mr. Elam?
Yes, that was a question that Mayor Ketron and I had ourselves, exactly what to do with this and the history of it. So do you have some insight on that?
I'm fairly certain, I mean, we're a recommending committee, but I think we recommend directly to the full commission. I don't think that this needs to go through another committee.
I'm not real sure. Mr. Elam, you don't have any history of recommendation like this?
This is Jay Crowell. I can tell you that in the past, we have recommended directly to the commission.
Yeah.
And we have never had anything go back to steering. And this is in my years on this committee.
Okay.
If I remember correctly, and this of course is just from memory, but I believe when we did the OMATA program, we went to the steering committee, and I think Jeff Phillips made that motion for the OMATA program to go to the steering committee.
Mr. Chairman, this is Jeff Phillips. I'm on the call, and I apologize for being late, but
That's okay.
Once again, I've had some issues with my laptop. But in the past, we have done a number of things to the steering committee, especially when it came to making changes to the benefit plan. And this is in years past when I've chaired that. I'm sorry. When I've chaired that committee, it has gone through the steering committee as it relates to increases in benefits, adding new benefits, or when dollars amount was actually involved in the process. Also, when it comes to benefits, the pension plans and all of those things always came through the steering committee. So there is a history in my memory of this committee making certain recommendations to the steering committee as it related to policy change and budget items and those type of things.
I think that's probably correct, Commissioner Phillips. If we don't actually go through steering, then who would actually present it to the full commission? So at this point, we would have a report from the steering committee to the full commission. Am I correct on that, Commissioner?
Yes, that's correct. That's what my memory, dating back a long time, recalls. But Commissioner Allen is right. We haven't done a lot of that
haven't added a lot of stuff
in the
right?
in the recent future. Yeah.
Okay. Well, that being said, I do have a motion and a second for it on the steering committee. Commissioner
I'd like to make
Allen.
an amendment to that. That if we're going to put this to the steering committee, I'd like to put it to the steering committee with a recommendation from this committee that we accept the wellness program recommendations.
Okay. So
I'll second that amendment. This is Jeff
second
Phillips.
on the amendment that it go to the steering committee with a positive recommendation from the Benefits and Insurance Committee.
Yes.
All right. We're going to vote verbally on the amendment. All of those in favor signify by saying aye.
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 Can I take roll call?
Any opposed?
Don't we have to have a roll call?
We will on the motion as amended.
Okay.
Okay. I hear no opposed, so the amendment carries. Back to the motion as amended. If you would, Madam Clerk, please call the roll. Ms. Corbin?
Yes, sir. Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber Brown.
Yes.
Shay Crowell.
Yes.
Holly Deering.
Yes.
Lois Miller.
Yes.
Jeff Phillips.
Yes.
Eric Tutobeni.
Yes.
All in favor, it passes.
Aye. Motion carries. Thank you so much, members. Next, we have the flexible spending account before us on the proposed rollover increase. Miss Melissa Griffey. Miss Griffey, you're recognized.
Good afternoon. Thank you, Mayor. In response to the ongoing economic impacts that we have faced with the COVID-19 pandemic, the Department of the Treasury and IRS published a notice as part of the relief efforts. So today we would like to bring forth that notice 2020-33 that provides an employer may elect to amend the rollover amount of contributions at year end that an employee has left over in their health care flexible spending account from the current amount of $500 to $550 to be used for medical expenses. So we would like to propose the amendment to our plan and also to propose a resolution to increase the rollover amount for a health care flexible spending account, again from $500 to $550 as allowed by the Department of the Treasurer and the IRS, beginning with the 2020 plan year. Thank you.
Any questions for Mrs. Griffey?
This is Lois Miller again. Melissa, did you say the 2020 or the 2021?
It would roll over from current year of 2020 and would be used for beginning in the 2020 calendar year.
Okay, thank you. That makes sense.
Yes, ma'am.
You might explain why this is required. It is a requirement.
It is actually an option that the IRS gives employers, but because it's not county funded money, we would like to request, because of the impacts of COVID, that some employees may not have had the opportunity to use what they've contributed at the beginning of the year and their flexible spending account. It is not common practice for the IRS to increase this amount annually, so we felt it best that we adopt this resolution to make it more available for our employees.
Any questions from Mrs. Griffey?
Mayor Ketron, this resolution is required before we can implement this, and health equity implemented, we'll have to have either an up or down on this. Or if you don't do anything, then we'll leave it at 500. But if we do something, we have to forward this on and have
Steering.
I guess, yes, through steering. But we'll also have to have something from the commissioners moving forward in order to implement it.
Well, I'll entertain a motion to forward this resolution and change to the steering committee.
Favorable.
I'm sorry.
Favorable motion or?
A favorable motion.
Mr. Chairman, this is Jeff Phillips. I so move.
I have a motion from Speaker Pro Tem Phillips. Is there a second?
This is Holly. I second.
And we have a second. Ms. Corbin, if you would, please call the roll.
Yes, sir. Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber Brown.
Yes.
Jay Crowell.
Yes.
Holly Deering.
Yes.
Lois Miller.
Yes.
Jeff Phillips.
Yes.
Eric Tutobeni.
Yes.
Mayor.
Yes.
All in favor, it passes.
Motion carries. Thank you so much. Last item is other business. We have a Mr. Elam is going to talk to us about SharePoint on the iPad. Mr. Elam?
Yes, Mr. Chairman. I just wanted to make the committee aware of we're trying to move more towards what the county commission has been doing with getting it on SharePoint and setting up the iPads when we ever do come back into regular meetings, and to try to get this information out there quicker and to cut down on printing and additional cost in the office. So next month, our goal is to have this on SharePoint. We have to go through the IT department to get it set up, and then to have it to where anybody comes in here will be on an iPad. And what we wanted to make you aware of, because the instructions that you have, we'll give them to you to get, like next month, we'll give them to you where you'll be able to go through and be able to see them instead of someone having to share their screen.
Okay. Moving forward, that sounds great. Is there any other business to come before this committee?
Mr. Chairman, this is Rhonda Allen. I have a question.
Yes, Commissioner, you're recognized.
Thank you. This may be for Ed or possibly Sonia. I'm not sure, maybe even Nick. The effects of COVID are really beginning to become more and more apparent. This is not going to be something that we're going to be able to deal with quickly. And so my question is, if we should ever be in a position where we have to furlough staff, and I guess I'm specifically thinking about the school system, if kids are not in school and at some point we have to furlough support staff, is the distinction of a furlough that they're allowed to keep their health insurance versus a layoff or a termination? I'm just trying to think ahead how that could potentially impact decisions this committee might have to make if we're having to pick up the cost of insurance for employees who are being furloughed. I'm just not sure how that piece would work. And if you don't know the answer today, we might want to investigate that and learn what that answer is.
Mrs. Stevenson, are you on? And you may not be prepared to say anything at this point without some research.
Many times a furloughed employee would be allowed to keep their benefits, unlike somebody who is laid off. A laid off employee would not keep theirs. And I was looking to see, it says that a furloughed public employee retains their employee benefits rights. So if this is still the most current law, and I would have to research it a little bit more, but if this is still the current law, then if they were furloughed, the employee would have to pay their portion of the premium, and the county would continue to pay theirs. The county would not be responsible for picking up the full premium. And that's how it would be for county general. I don't know if there's a difference in what would happen at the school systems, but I just know for government employees, that's one of the things that's required. And I had I'm sorry.
Very good. No, I was just going to say thank you.
I was going to ask a question under the other comments, if it's appropriate at this time. Is that okay, Mayor Ketchum?
You want to ask a question?
Mayor Ketchum, may I ask another question?
Questions?
I was wondering if Cigna had a program talking about the COVID, and that was where my question was coming in, not knowing how this is going. You know, our hope is that it goes away, but in the event that it continues and escalates, there's a program, and it is called, I wrote it down, called Base Camp Health. And I don't know if Cigna has anything similar to it or if they have a partnership with somebody like this, but the Base Camp Health allows for, it helps us to track, it's called a Return to Work Safely program. And it's specifically set up, the Ascend piece of it is specifically set up to help deal with COVID, to make sure that we are not having like hotspots in the county, like certain departments, and it also requires that the employee do some reporting before they actually come into work. So whereas we wouldn't be doing temperatures at the locations, it would be more of the honor system doing it through this. And, you know, I don't know that that's something the county wants to do. I was just wondering if Cigna had ever heard of this program and if they had anything similar to it.
This is Paul. We've heard of a few programs that are out there for return to work assistance. We have on our website, on our COVID resource website for even for clients in the K through 12 industry. The thing is, the questions that are asked of individuals are still on the honor system, as you said, and they're very simple questions that most people already know and can ask on their own each day, and you're still dependent upon that honor system and that self-responsibility of individuals who are coming back to work to be honest with their activities or who they've come in contact with, or if they have a fever and things of that.
You're fading out. We lost you, Paul. We can see you, but we can't hear you.
Our COVID, and because we've got all that out there, and also check with Lee Smith in our Cigna engagement consultant, so that she can get that information to you.
You want to repeat that? We lost you. We lost about a minute of. We just saw your lips moving, so I think we got the gist. Can you hear us?
I can take it off. We can give you the Cigna COVID resource website for returning to work, especially, and the materials that we have developed for the K through 12 returning to work.
Okay, that sounds good. Any other questions?
Go ahead. Sonia, I was just going to say part of that, I think I heard what Paul's saying too, it's the honor system, but when we look at it as well, it's probably good to have a tracking system from a liability perspective. So at least you have a tracking system that people are responding to, whether it's the honor system or not.
I think that's a real good point from a liability standpoint.
Paul, or not.
Yes, sir.
I just didn't want to I didn't want it to be a huge expense, but to the point of the liability that if we ended up and they said we weren't doing enough, we're taking temperatures, we're keeping up with the logs, we're maintaining those. We've been doing that for months and months and months. The departments are taking their temperatures and they're sending them to me on a weekly basis, and I'm keeping those in a register to keep up with it. But they're very HIPAA compliant. We have to make sure, because that is, employees' health information when you're taking their temperature. So I just wanted to see if there was something else that maybe, in the event that somebody says at some point in time that they're not comfortable with that, I wanted to make sure that we had something in place. And I noticed when I started looking at the school systems, the plans that they were making to come back to school and being safe for the students and the teachers and administration and the workers. That seemed to be a common tool that was coming up. And so that's why I started researching it to see. I know it specifically has a lot of things around the school systems, but they also offer for other employers as well. So I was just asking to see. Thank you.
Thank you. Any other comments or questions?
Mayor Ketron, this is Jeff Phillips. I'd like to follow up on Commissioner Allen's question about the potential of furloughing employees. Could Sonia maybe get the absolute correct answer and kind of work through the steering committee as to what may happen there? Would that be possible, Sonia, for you to report to the steering committee as to what may happen if God forbid, we ever had to do that?
Yes, sir. I will research all. I'll do a layoff, and also I'll do a furlough if we have to do that. So yes, sir, I will do that and report back to the steering committee.
It would probably be good for us as a commission to get ahead of any particular situation like that, so we would know what scenario might.
I think, Commissioner, that's a real good point, and as opposed to us having to react, at least we know on the front end. And if Sonia, if you'll work on that, I'll give Commissioner Harris, Chairman Harris, the heads up that we'll be putting that on. Can you get that done by his next steering committee meeting, Sonia?
Yes, sir. And I will also go ahead and I'm going to go ahead and send Nick an email right now too. So he and I both can be researching it and make sure that we're on the same page. So I will send him an email as soon as we get off the meeting and just say that this has been requested. And so he and I both can look at it. They have a lot of things for the reduction in workforce. We have a RIF plan. Luckily, we've not had to use it because back in 2008-9, when the economy had a downturn, we were concerned at that point that we may have to lay off or furlough employees back then when the economy dropped. And so I created one. I just need to make sure it's up to date with what today's laws are. So.
And Ms. Stevens, let me know too if you need to ask questions even on disability. So we've had a lot of clients furlough and lay off and do different things as far as how much they would pay towards the benefits. But where the tricky part kind of gets into is some of the disability and life insurance. So the medical, dental, visions kind of can be straightforward maybe in your wording, but then short-term, long-term disability, supplemental life insurance, those may be a little trickier. So if you're unclear about that, definitely get with us and we can help look at the policies and see.
Well, if you have a template that you've used for someone else, obviously I know you'd want to take their name off, but if you have a template, I would absolutely love to compare that to what we currently have.
Okay, I'll check with Matt. And mainly it's each policy reads different. And that's where I was kind of waiting to see what you were referring to there, because to your point exactly, a furlough normally means that the person is able to come back at some point, where a layoff is we're not holding their position. And then each employer has different language, as you were saying, around do we pay for benefits or not, their portion of the benefit. So that can vary. And so if you have actual wording on that, but we would really need to talk with your carriers on the life and disability to see what they would allow. It's more like what's in the contract, and we can do that.
Well, it's like our Speaker Pro Tem said that God forbid that ever happens to us, but at least we're prepared and we know what the next step would be in the event that the decision has to be made quickly.
Right.
Okay. Thank you very much. Any other comments or questions to come before this meeting?
Mayor Ketron, this is Shay Crowell. I'd like to request
Shay.
a point of personal privilege.
Please, ma'am. You're recognized.
As the REA representative to this committee, I would just like to say thank you for mandating masks for our county.
Well, thank you. I wish you'd told those people outside at the protest. But thank you so much. I appreciate that. Is there anything else to come before us? Is there a motion to adjourn? Hello?
So moved, Mr. Chairman. So moved.
Thank you, Speaker Pro Tem. We got a motion. Is there a second for adjournment?
I'll second. Shay Crowell.
Thank you, Ms. Crowell. All right. We are adjourned. Thank you so much.